I've heard people say, I was thinking about palliative care, but it may be a bit too early for that. Or I was considering palliative care for my patient, but I don't want her to think I've given up on her. Let's spend a little bit of time talking about palliative care in neurology. I have nothing to disclose. The objectives are to provide an overview of palliative care, to discuss palliative care in neurology, and to present cases that illustrate palliative care concepts. Definition of palliative medicine is really specialized medical care that aims to recognize, prevent, and alleviate suffering of all forms: physical, social, psychological, and spiritual suffering. But not only for our patients, but also for their family members. It's really a whole person, whole family approach to care. Many people think that palliative care is appropriate only at the end of life. Hurry, 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 somebody call palliative care. My patient's about to die. But really, we know palliative care is appropriate even at the time of diagnosis and throughout the course of medical disease. Even after a person dies, palliative care can be helpful in the form of hospice care for family members. So palliative care is appropriate at any age and at any stage in patients who have serious or advanced medical conditions, independent of whether the goal is cure or maximizing quality of life. In 1996, there was an article in Neurology titled Palliative Care in Neurology. Dr. Burnett said it's imperative that neurologists understand and learn to apply the principles of palliative medicine. That same year, there was another article that stated that neurologists have a duty to provide adequate palliative care. In order to do that, we have to have a working knowledge of the clinical pharmacology of opiates and benzodiazepines. 3 years after that, there was a survey given to U.S. neurologists to see what their attitudes, behavior, and knowledge was about end-of-life care. Of those surveyed, 37% of neurologists thought that it was illegal to administer analgesics in doses that risk respiratory depression in terminally ill ALS patients. 40% of neurologists thought that legal counsel was needed to consider stopping life-sustaining treatment. And 89% of neurologists said, we need more training and more education on this. So neuro-palliative care, what is it? Well, as the name suggests, it's palliative care for patients with neurological conditions. Essentially, all neurologists are doing some degree of palliative